Hello, everyone. Welcome to this webinar of the International Society for Telemedicine and eHealth, organized in collaboration with our Finnish member, the Finnish Society for Telemedicine and eHealth. We will immediately, obviously, jump into the topic of today's webinar and a focus on some of the very interesting Finnish telemedicine and digital health experiences and activities. But just a few words and a warm welcome on behalf of the FSTeH, the International Society for Telemedicine and eHealth, which, as you may know, is a global network of digital health organizations and players in that field. And today we have a webinar that is organized by our group of national members, national societies with a focus on telemedicine and eHealth. And this is the first in a series that will continue throughout this year and the coming years, where each time one of our national members will present initiatives and digital health activities that are going on in their country. The International Society for Telemedicine and eHealth is a global network of digital health stakeholders, so it's national societies, but also companies who provide digital health products and platforms. It's institutions with a focus on education, on research. It's individual health professionals with an interest or an activity in the field of digital health. And so the networking part is very important. We try to bring the stakeholders together so that they can exchange their knowledge and experience and learn from each other. We also have a focus on education and training, and we will actually have a few interesting new things coming up in that area very soon this year, so keep an eye out for that. We work on policy advocacy also through our links with the WHO, the World Health Organization, and we have a large community of researchers who are part of our network as well and do research in the field of digital health. And so it's all meant to strengthen global partnerships, as I mentioned, and to make sure that the knowledge and the experience that has been out there for so many years is shared among stakeholders so that they can move forward in a better and a faster way and create partnerships, collaborate together at various levels. As mentioned, this webinar is hosted and organized by a group of national members and chapters, and this has been led so far by Dr. Pirkko Kuri from Finland and Professor Hassan Ghazal from Morocco. They have held and brought together meetings with the various national member associations, and one of the things that has come out of this is this series that has now been started up of webinars with a focus on national initiatives. So enough from me. I encourage, of course, everyone who is not yet a member of our network to join or to contact us for more information. But with this, I would like to hand over to Outi Ahonen, the president of the Finnish Society for Telemedicine and eHealth, to introduce the Finnish Society and the speakers of today. Thank you very much.
Now I think I'm ordered to let us share. And it's working smoothly, didn't it? And thank you for having this opportunity to be the very first part of the very first webinar in ISTE, and that we are from Finland. So the short visit from Finland is a small country in Nordic, and we have about 5 million for us, and a lot of islands and the sea around us. And then there is in the middle of the picture about the Finland, the well-being counties. So there is a huge transformation in Finland that we have the well-being counties who are organizing our healthcare. And I will come back to our presenters very soon, just in a minute. For here shortly about the Finnish healthcare. So we are doing the digitalization, so it should be as a first contact to our nationals, and there is that efficiency, accessibility, and quality of services. Those are the keys, and we electronic health record is all around the Finland, so it's we need to have it in every our service place, and then we also have national-wide system like Kanta archive. It helps us to transfer our digital health record knowledge, and then it's also important that I think it's good connection us to when we have the European health database, what is coming on the next year. So in the Finland e-services, as citizens can book appointments, as prescriptions, and we the e-health information around. Also, integration and interoperability, it's important to us because there is we can connect health and social care, and that's one of the strong issues in Finland, that we would like to have the common health and social care part, and try to standardize data change also on both of these parts. And when we are planning, it's about the data analytics, use predictive care, resource planning, and personalized treatment. And remote services, we are not the large country in the world, but still we have the long distances, and that's important to us. That's why we have the telecare. And also about our the visions of our country is that on the last autumn we published our vision of 2035 as an AI, and we try and we're willing to be as a country where AI is we are transformed AI fast, but not that we still are the runners of the AI, and AI is not running us. And the vision of the principles you can see here in the picture. And when we are seeing this slide, we are sharing this slide, so you can check this also later. But there is these visions that AI could be the coach even to the children, small children, and later, and have the health habits on their life. Of course, open and mobile automated health and well-being services, what are part of they, and the AI assistant and the care, and also the professional partner and supervisor, how AI can be our helper and somehow our colleague, but on the good level, not that they are running the system. And then how we are leading the people to the AI transformation, and that's also for the professionals, and of course also to our people on the centric, that there's a lot of knowledge what we need to have. So it's important to our country that we are checking what kind of common knowledge creation and competencies the healthcare professionals are needing when we have more and more AI running systems for us. And that's shortly about the Finland. I hope that there was some new to us and to you. And then I go to our association. So our association, Pirko, is one of the very strong member of our association, and she has been also very strongly part of the FSTeH, and now if we say that our association is published on 95, so we are now 31 years old, so not anymore so young, adult age already, and we have been also the FSTeH's second member and the national member, so the long way of coming over to here. I would like to point out that you can see here when we have that 5 million, it's not so large number of the people, but still quite active number of the people when we have those less than 300 members. But then if we think about what is the something results from our side, what you could also use, that there is this, we have this Finnish Journal of eHealth and Welfare. It's published and it's open journal to all over the world. So you are also welcoming to the right to your articles and also read. So there it's just when you get these slides, there is that link where you can go and have that Finnish Journal of eHealth, or even Google that on the front. If there is some Finnish, would be great if you could add that to the chat, to that link to help to the others. Then shortly about our association still. So we think that we are a recognized and trusted meeting place for the telemedicine and eHealth. And what we are doing is that we also have those eHealth conferences each year. And next year it will be, this year it will be on November. No, not October, sorry. And the effective digital solution in healthcare and social welfare services. And I'm very pleased to tell that Paulus as a effectiveness association is also part of those organizations. Now I go back to the very first, and I start presenting our webinars participants. And so my name is Outi Ahonen, like Frederick told you in the beginning, and I'm very pleased to have Elina Laukka with me, our treasurer as association part, and also colleague from north from the Oulu's University of Applied Science, and Elina is leading with me this our webinar. And then Paulus Torkki, he is associate professor from healthcare operations management at the University of Helsinki. So there's 600 kilometers between their offices, isn't it? And then very next to the Paulus is Silja Kosola, adjunct professor research at the Western Uusimaa Wellbeing Service Counties. And when I was telling that we have these different kind of well-being service counties, now Silja is presenting them. And then thirdly, Jaana Kotila, she's the development manager, Hospital District of Helsinki and Uusimaa, and Jaana is running the national eHealth services, and that sort of has a more specialized care. And that's the way how we try to now help you to come on that. What is the effectiveness of digital health care services? And while I'm closing my window for here and giving floor to the Paulus, I also hope that you could start when we are having this webinar, that you can have your questions to the chat. And when there comes this question part, we try to answer your questions. And of course, we also have our own questions to the panelists. But thank you, Paulus, to start our presentations, and warmly welcome.
Thank you, and thank you for the introduction. So I'm Paulus Torkki, Associate Professor of Healthcare Operations Management, and I will very shortly give an overview of this topic from the research perspective. And when I'm talking about digital health services in this presentation, I mostly mean interactive digital health services, so not only that kind of solutions which are sharing the information between stakeholders. First of all, as we know, the digital health services have been developed very rapidly recent years, and when we evaluate the impacts or effectiveness or cost effectiveness of the solutions, we have to understand that different solutions may have different goals. So for example, the most common digital health solution in Finland is at the moment digital chat-based primary care solution, which covers already over 80%, maybe even more, of the Finnish population. And its goal is efficient care of minor health problems, so kind of reducing resource use and costs in minor problems, maybe not affecting the outcomes. Then there are also various kind of digital care pathways. Maybe Jaana Kotila will tell about those solutions in HUS later on. They sometimes just try to replace a physical visit, but I'm mostly focusing on chronic care today, and there are also the digital care pathways may offer solutions supporting the value co-creation between patients and professionals, and various kind of mechanisms to also improve the outcomes of the care. So I have some examples of the effectiveness of digital health solutions in chronic care, and it's based on our recent review of systematic reviews, and also quite a little bit different review in Lancet Digital Health 1 year ago. So in general, when we analyzed the different digital health solutions in chronic care, we found out that the outcomes in those systematic reviews were most commonly comparable between digital health solutions and traditional solutions, or in some cases the outcomes were improved. So the green arrows here illustrate that in these cases the outcome measures are improved. In some patient groups, it was already possible to do the meta-analysis of the system based on the systematic reviews, and we found that in type 2 diabetes, hypertension, and heart failure, there is already evidence showing that the published studies support the improved outcomes when using digital health solutions as a part of the care of those patients. But as I said, we found 11 patient groups, so in other 8 groups the outcomes were comparable. So therefore, when analyzing the cost effectiveness, the question is that if the outcomes are comparable, will the costs be greater or decreased? And the preliminary analysis of these studies show that in most situations the resource use and costs are decreased. Of course, we have to understand that there may be some publication bias, so maybe the studies that support this cost effectiveness are more easily published. The other important topic is that the studies are currently having a lot of heterogeneity, also in terms of how the patient group is selected, but also what is exactly the digital health solution under study. And the future studies, I think, require better description, especially of the interventions and the digital health solutions, to make it easier to compare different studies and the findings of the studies. But if you very quickly summarize the findings so far, so this is the digital health solutions in chronic diseases. I think the strongest evidence is on patient satisfaction, that most of the studies are supporting that the digital solutions improve the patient experience. The outcomes were varying, as well as the care team well-being, but the economic outcomes show that in most cases, most published cases, there are positive results, so that the digital health solutions are reducing the costs. I will finish my presentation showing what we are currently studying, so the value co-creation in digital health solutions, and we also have to understand that different users also get different outcomes in these digital health solutions, and both the value creation capabilities of the users, but also professionals, have to be understood when evaluating the effectiveness and cost effectiveness in the future. Thank you.
Thank you, Paulus, so much about your presentation, and that's the research-based, and of course Silja's presentation will also be on the research base, but then on the more practical part. And knowing Silja, thank you that you are here. We know that you have a bit flu, but then we believe that everything goes well still. The floor is yours. Thank you.
Thank you very much for a kind invitation, and my greetings from Western Uusimaa Wellbeing Services County. We can move on to the next slide. To describe this transformative journey that we've undertaken, it's important to understand that all the Wellbeing Service counties started in early 2023 In our case, this transformation was huge because we started from 10 different organizations, 10 different healthcare systems and EMRs that were brought together. But starting early last year, we moved on to a very strong development focus. And this is what I'm going to describe to you, what kind of digital services we are developing for our clients and patients, and then the two different sides of artificial intelligence that we've already started incorporating in our system. Moving on. Lunna is a telephone app that is now available for all the people living in our area. We are the third largest well-being services county with a population of more than 500,000. I know internationally it's not a very great big population, but Finland-wise, this is the scale of population that we're talking about. The application is available in 3 languages. Finland's 2 official languages, Finnish and Swedish, but then also English because of our growing multilingual population. Next. Most of the services that we now have available in Lunna are the chat services in the upper left-hand corner, and then non-urgent messages that are available 24/7, and you can expect a response within 3 business days. In addition, we also have some video appointments in the right upper-hand corner. We have also a pilot now that has started within the health centers where you can start with a chat and then it can be transformed into a video appointment in an ad hoc way. We also have self-help programs, several of them that started in November. They're based on previous evidence, and so we're just incorporating that into a digital format. But then we also have our first treatment pathway, digital treatment pathway in the lower right-hand corner for lower back pain. And this is opened by a professional, but then the treatment pathway continues in a digital fashion thereafter. And the arrow just points that this is the one that we're actually also expecting to find true health effectiveness measures in that pathway. Then moving on to artificial intelligence. More than 20% of the population in our area speaks other languages at home besides Finnish and Swedish. And so in every consultation that we have had to call in a proper interpreter, which is very costly and very slow. So we've developed an AI application that listens to the conversation in the consultation with the professional and the client/patient and translates it into the target language and backwards at the press of a button. And so far we've got pilots going in some prenatal clinics with maternal care and social services that support integration. And the pilot languages that we've started with are Ukrainian, Russian, and Arabic, which are the most common languages besides Finnish and Swedish. In the next slide are the key first learnings from this. It has been very convenient because it's always available and completely neutral. There's no, you don't need to take into consideration, for instance, a person's religion or the area where they live, which might be problematic with live interpretation. However, the quality of translations has varied between languages, and this is something that we need to be very mindful of. But as people have used these more, their reviews have become more positive. And there is a very strong focus on change management so that people get the proper education and also are involved in leadership in taking on this new tool. Then the other AI use case that we have is the AI scribe, which again, the problem is that our healthcare and social workers spend so much of their working time in written documentation. And so in this solution, the AI assistant, again, listens to the whole conversation during the appointment and it records it. And then another AI application generates a written draft, which then the healthcare or social workers check and correct as needed. And this has been, again, piloted with 3 different worker groups. What we've learned from this as our preliminary learnings in the next slide. Oh, right. So I was describing even more clearly again the speech recognition that is used and then the large language model that makes the draft. But in the next slide, we have the learnings from this, which I have omitted somehow. Okay. We have learned that, again, the LLM makes some mistakes. It does hallucinate still, despite the working that we've done. And it requires constant development to make it even more trustworthy. And the professional's review still takes some time. So we're not quite sure how much time this will actually save. We have studies ongoing with both internal and external study groups, but we don't have the results, unfortunately, quite yet. In my last slides, I have the names and contact information for the people who are even more directly in contact with the artificial intelligence and digital service development. So if you want to have any more specific questions about these use cases, please be in contact with Nelly, Riikka, or Anssi. Thank you.
Thank you, Silja. And then I will share a screen to the Jana's presentation. And now we go to the specialized care part.
Hello, everyone. My name is Jana Kotila, and I'm currently working in Helsinki University Hospital. And my case studies from Finland is for Health Village, how we created this model of excellence and used our contact with all the university hospitals collaboration in Finland. So we started. Next one, please. Here you can see the overview of the Health Village as a public online services, and it contains 3 different kind of services. One which is the digital path, and currently we have over 300 digital paths in whole Finland, and 130 are here in Helsinki University Hospital, and all the others are in well-known countries all over the Finland, mostly in northern Finland, there in Oulu region. And the second service is these self-care programs and hubs. They are virtual selection of guidance in different kind of diseases, and it's available all over internet, so you can use it very freely and see what kind of information there is. And this Health Village Pro is for professional users, and there you can find strategies and protocols and webinars and all kind of material for the people who are working in healthcare or social care areas. And as you can see, I have put there that the Health Village is a success story, and It's so because it has been Finland now 10 years today, 2026. It's 10 years anniversary, and we are very proud that it's started so early and collaboration with all the university hospitals. And a social innovation because we have over 500 professionals working with us and created the contents. So all the new ideas and service processes are coming from the professionals. So they know what they need and what they want, and also patients can be part of the process for these services. And a software for last year, 25, we get this software prize for improving citizens' quality of life, and also the significance what that plays in health and social care. And all the material are evidence-based information, self-care tools, and digital care pathways. And the platform is CR market, so MDR regulation is covering in all our services. So then we go to the next one. And this is something that tells where we started 10 years ago. We started on development network invitation for the university hospital and professionals, and also the patient participation in these development processes. And we built these multidisciplinary teams. And when we gathered these people, then we started this proof of concepts and service architecture for building these services. And between the development process, we product this eHealth development model, which I present you the next slide. But we needed all this because we started from scratch. So everything are built with our national cooperation with the universities and professionals and schools, which were part of this planning. And then we created this new eHealth services, where now Health Village is the part of everything. So when we check the next one, please. Here you can see this eHealth development program, and there is like 3 different kind of levels: the organization level, clinical units, and platform and methods. And this platform and methods are where I work. Like this platform is screened and development in HUS and all the other university hospitals, and we have these champion networks and digital mentors development with us, these new services. And clinical units, like you can see, there is a double diamond, something that is called in service design, and we have used that. And that is still used in every our services, and we take a pilot studies, and we use engagement methods, and also we have research groups who has research these development services and we get results, and then we can redesign and renewal our services when we get the results. And the organization level is the level where the change leadership and change management is taking place, and that is very important because nothing in digital world goes in the real life if the change management is not in place and when the support is not enough. Okay, then the next one is something a review of our studies, and because we are MDR market placed, we have to gather also these clinical studies and the clinical evaluation report. We have find of these 4 main topics: improve access to care, like the Paulus said, and also our services provide reliable information to the patient and the users, and it stands out from the commercial platforms because the collaborating operating models and these strengthening cooperation also between now in primary healthcare and specialist medical care, so we can share these digital care paths in both ways, and it enables the exchange of medical information, which is very important to have a better visibility to the patient who are situated in home, and they can get interactive technology in their own homes and can use these digital care pathways. All right, and next is my final slide, where you can see that all the drivers of eHealth services are targeting that the patient get the value-based and center of care, and all the care is based on data, not time or place or situation or individual healthcare professionals, but it's value for the patients. Thank you.
Okay, thank you, Paulus, Silja, and Jana, for your excellent presentations concerning the digital health and social services in Finland. We are a bit behind our schedule, so let's start now. I think we don't have any questions yet on the chat, but Outi will see if there will come some. But I have some questions to you. So, to begin, Paulus, could you please tell us a little bit about how should the effectiveness of digital services be assessed, at least in theory? And maybe you could also mention 3 to 5 main actions, what to do.
Thank you. I think in general, the methodology is comparable to any other intervention. So you should build a comparative setting where you have the digital health solution and something which you compare. But as I said, the goals of the digital health solutions may vary a lot. So it would help you if you think about both the objectives or goals. What are you aiming to change with this digital health solution? Is it realistic to expect that it affects somehow on the clinical outcomes or patient-reported outcomes or something like that? And defining the goals and objectives helps you in identifying the measures for the effectiveness evaluation. General 2 points I want to give is that first is that try to also understand the impact mechanisms and describe them. So what I mean is what kind of features do you have in your digital health solution? So is it like a chat or alerts or sharing the information? So what maybe then you may understand also the reasons for the possible changes in effectiveness. And another one is that currently the studies are quite short. So please build long-term follow-ups also, although you always want to see the results as soon as possible. So that will also help in assessing the real effectiveness in the future. Thank you.
Thank you, Paulus. Well, Celia and Jana, as you were presenting more, let's say, practical solutions for us, how would you assess that these actions that Paulus just suggested, how do they happen in practice, and what kind of challenges do you particularly observe in these, and do you have any ideas how to overcome these barriers?
Thank you. That's a very relevant question. So far, for most of our services, chat and the non-urgent messages, we've set the targets for client and provider satisfaction, and they've got clear numeric targets that we're aiming at. Also, for the response times, we follow them, that we actually provide what we've promised. However, as to the actual health outcomes and whether they change due to these solutions that we've had, this is a little bit more problematic, because as in any development of technology, the development is so fast that any time you try to suggest a proper research protocol of a comparison group and an intervention group, it slows down development. And so this conversation is something that we have constantly going on within our organization. What are such relevant changes that we do need to get the actual research data as well, and which ones are sort of no-brainers that we just want to do this anyway? Thank you.
Thank you, Celia. Jana, can you continue?
Yeah, we have similar challenges and similar collection of feedback. We use the user satisfaction, and we collect them as a NPS from the clients and also from the professionals. And it's currently so that we measure these constantly, and we monitor them bi-monthly, and because we have to also report these feedbacks and also the technical problems to the MDR legislation, then we use the data for the bettering our services all the time. But there is challenging things that the fragmentation of these digital care paths, and they are not linked in the integration like HER programs, because it's open in our in Health Village, all the technical are open, but in the ER development are so slow that they can't integrate these digital care paths in the HR systems, and that's a problem that we are struggling in this time. Yeah.
Elina,
Yes.
would it be if there is the Nihal Habib from Morocco
Yeah,
would
I
like
know
to
the
ask?
question. I can read it to our panelists.
Yeah.
I think this mainly goes to Jana, but I think also Paulus and Celia, you can also answer if you have any ideas. But the question is Based on your experience with Health Village and digital care pathways, what do you think is the essential for scaling these models beyond Finland, especially in countries with different levels of digital maturity?
Okay, very difficult question, but I have one answer because we have sold our baby journey in Europe, in Bulgaria, and the material were translated to English, and they have implemented this baby journey in their own systems. And we have these questions all over the world, but Bulgaria is in Europe. But we have also these questions from Australia and other countries. Maybe the Israelis was the one, but they need to develop their own like the service platform first to implement these service like it's all the contents that are made here in Finland. So yeah, it's very difficult, but it has been done in Bulgaria. Yeah.
Jana, there is a further question. In which company or institution it was implemented in Bulgaria?
Oh, I don't know that because I wasn't in part of that, but I know it was sold there.
Yes, thank you. Paulus, go ahead.
Yeah, just a comment. So I think they are quite scalable. Maybe the problem is that, well, Jana said that it's also, there are reasons why it's in-house development. It may be good solution in terms of HUS, but it's not the primary business of HUS of selling those applications to other countries also. But we have some Finnish companies which have scaled their digital care pathways in many countries, and I think that's a good question, and I see them quite scalable. But of course, you always have to think whether you develop a context-specific solution or a kind of scalable solution for a specific patient group in many contexts. Thank you.
Yeah,
Thank
my
you.
comment would be from the perspective of a board member of World Vision Finland, where I've served for 8 years and seen quite a number of different countries at different stages of development. I would say that it's one thing to provide health information online from a trustworthy site and spreading the information on how to access that. And then it's a completely different thing to actually start a digital healthcare pathway where you also need to take care of data protection and so on. So I would say that for a country that is still in the early stages of digital development, this is not the first thing to pursue.
Thank you, Silja. So we don't have any more questions, or do we? It is just a comment, or is it a question? No, it is a question. How does Finland make sure that digital health services remain effective and safe as they move from pilot projects to nationwide use?
Maybe again
who
to
wants
Jana.
start? Yeah, maybe Jana would start with this.
Data protection was the answer or question. Yeah. So we have all the legislation and all that kind of thing in Finland. So we have to regulate, and we have to also build the protection bars in our solution so they can't be attacked, and they are monitored all the time, so the patient data is safe in these surroundings. So because we are Finland, so we are very far in this state also.
Thank you, Jana. Paulus, you can continue.
Yeah, I think also our ministries are quite active in now funding the evaluation programs. So we have quite many research or other kind of assessment programs going on, evaluating at the same time. From my perspective, even if I'm a researcher, I think we are wasting maybe even too much safety and all that kind of things in terms of fast development of the digital health solutions. So we have quite a strict regulation and rules for implementing the new solutions. Yeah, thank you.
Elina, could I point based on that I think that also what Jana says, but that also that was the national project where the Health Village started. So I think that was also quite good starting point, that there was I think all our university hospitals were part of that. So it was built on the national thinking, and I think that's important. Of course, it's a bit different when we are only this 5 million, but still. So that was a large project as a national funded.
Very good point, Outi. I think we can go to the next question, and this one is very interesting. Susanna asks, what is the most urgent next step development in digital health services? Maybe Celia, maybe you could start, because you were talking about AI. So let's see, do you have any other suggestions for this question?
In our organization, we take AI very seriously, and we're very optimistic about many of the use cases that we have. I know that we've had workshops specifically set up for people to brainstorm together what kind of use cases we could have. Now, unfortunately, I don't know what is already in the pipeline as the next one that we will do. This would have to be answered by Nelly, unfortunately.
Thank you, Celia. Any further comments from Jana or Paulus?
I could say that the Health Village point is that we are developing our digital care pathways, more personalized model, so there can be IE helping so that the patient sees content that is relevant just for her or his condition, because nowadays all the pathways are contained so that the information is similar for everyone in that condition, but then further on it's going to be in personalized, and it's in development 27, so very soon.
To Elina to notice that there are a couple questions.
Yeah, I noticed that we have 3 minutes left, but let's take this one, because I know Paulus is very enthusiastic about value co-creation and wants to comment something about that. But let's see I think this goes to Jana and Celia at first. At what point in the co-creation process should a team formally engage with regulatory bodies? What is the earliest, most effective conversations to have? Any national standards or legislation facilitate this co-design probe in Finland?
We start these conversations very early on, because if you start to develop something and then run into the barrier of legislation, you've just worked for nothing. So whenever we start something that seems to be new, where we haven't tested the boundaries of our legal frameworks and also data protection, we start that conversation with the professionals early on.
Yeah, my mind is the same. We started very early in these cooperation groups, and it was ministry was funded this Health Village project, so we had them in first stage participation in when we started. So yeah.
Yeah, I would also add and support this as early as possible approach, because we still see like we are just replacing some traditional ways to do the care with the digital solution. But if we really aim in digital first solutions, which transform the whole process in the future, the earlier you start the co-creating, co-designing, then maybe it will lead not only from the legislatory point of view, but also developing the services. Thank you.
Thank you. Okay, we have 1 more minute, so this question goes to Celia. How much the AI voice scribe agent costs, Ruli?
Sorry, I can't answer. That will have to go to Nelly again. I'm only responsible for the research side of things.
But it's good to know that there will be this kind of data when we meet Nelly someday.
Okay, I think we are running out of time because we have only some seconds left, so maybe we will continue. Yeah, there is a comment, pricey, I guess, so yeah, probably those are quite pricey, as digital health services always are. Okay, maybe now the closing words.
Thank you for our side, and over to you, Fredrik.
Thank you very much, Outi, and thank you to all our excellent speakers. Thank you for your time and your insights. And as mentioned, this was the first webinar in a series that we will be presenting together with our national member societies in countries around the world. And the next one is actually already in the planning, and therefore I would like to give the floor just for a few minutes to Dr. Umashankar from our national member in India, the Telemedicine Society of India, who will be organizing and hosting the next webinar. So over to you, Dr. Umashankar, just to announce this webinar.
Good evening, all. Thank you, Fredrik. For some, it's, I think, good morning as well. So thank you for giving us this opportunity, and excellent presentations, all the speakers. And I would like to invite everybody to next month, February 11th. So India will be hosting the same similar webinar. As you know, India is a large country, and we have been implementing telemedicine for the last 25 years. So we intend to talk about how digital health and telemedicine has been implemented in the country, both from the private and the government sector. And we are in various spectrum of digital health, and many of them have also started utilizing AI. So we will have one presentation on AI and how we are doing. So we give you a broad spectrum of rural and how in the government, private sector, and how do we scale. Any program is about scale, and India is a large country, and we will be talking about how India has scaled the digital health ecosystem and telemedicine. So that is what we are going to talk about. And I invite everybody to come and join us as we host the next webinar. Thank you. Thank you for the opportunity.
Thank you very much. We look forward to that, and we will indeed be sending out announcements about the date, time, and the topics and details of this webinar. So thanks again for joining to everyone, and we will see you on the next webinar. Bye.
Thank you all.
Thank you. Bye.
Thank you. Bye.
Thank you.